Sioux Empire United Way meets the needs within our community by funding more than 80 different services. We help children, vulnerable adults, and people in crisis through a variety of services. Good happens across our community every day through United Way funded programs, and that is especially true now as our community handles the impact of COVID-19. Today we have with us to chat is Amy Carter with Children's Inn. Thanks for joining us today, Amy.
Yes, hi Annie, thanks for having me.
Absolutely. So why don't you tell us a little bit more about what you do at Children's Inn for those who maybe aren't as familiar?
Sure. So Children's Inn, we have been serving the area here in Sioux Falls and surrounding communities since 1977 as a domestic violence shelter and services, crisis intervention, and other services for victims of domestic violence, sexual assault, stalking, human trafficking, and child abuse and neglect. So in addition to our safe shelter, which is what people typically tend to think of us as, we have our 24-hour crisis hotline. We offer support groups for survivors of abuse. We do counseling for victims and survivors, parenting classes, public education, advocacy in a variety of ways. So just really wraparound services, I guess you would say, for victims at any stage of their healing and their need.
So that is a lot of different areas that you have clientele, but what does your average numbers kind of look like, and what is the change from maybe a normal time to now?
Sure. So when we look at our statistics for last year, we had over 1,100 intakes into our safe shelter with averaging about 47 people a day. Our capacity is 40, so that gives you a little bit of an idea of how many people, how we're typically operating over capacity. In fact, about 76% of the time last year, we were at or above our capacity of 40 individuals in shelter. And that's just shelter. With our crisis intervention, we responded to almost 6,000 crisis, whether it was people stopping in for services or going into crisis phone calls. So when you look at this year, or especially right around this COVID pandemic, we have our shelter services. We've only had about 25 people in shelter a day averaging. So prior to COVID-19 for 2020, we were seeing 49 people a day in shelter, and now we're averaging about 25. So a pretty significant decrease, which lots of reasons that we are kind of anticipating why that might be the case, but certainly not something that we know. Domestic violence is continuing, and we know that, but I think it's just more challenging for victims to reach out for services at this time.
What types of adjustments have you had to make internally in response then to COVID-19? So obviously some of that is a decrease in numbers, but what else have you had to do?
Right. So because of that decrease, we wanted to make sure that we're continuing to get the message out that we are open and that we are safe and available for people. It can be kind of scary to leave your house at this time anyway, and then imagine leaving an abusive situation and coming into a shelter where there's a lot of people. And so we know that that's part of it too, is possibly that fear of coming into a shelter setting. So we have done really as much as we think we possibly can to make our shelter as safe as it can be. We're having individuals stay in their room more often. We serve meals in their room. We limit the number of people in our common space areas. All of our staff are wearing masks at all times, and those staying with us are welcome to wear masks as well. We just don't require it. We take our employee temperatures. We sanitize our shelter and the administrative areas 3 times a day, which, every 3 hours actually, and it takes almost an hour to do that sanitizing. So it's pretty continuous that we're doing that sanitizing. So, and lots of other little things here and there in order to make sure that we are keeping those individuals safe that are coming to stay with us, but then also, of course, our employees. We don't have the opportunity to work from home, a lot of us, because it is that direct care essential service, and we're committed to that and glad to be able to do it. We just want to make sure we keep everybody as safe as possible. And then I should also mention our counseling services and any services we can do remotely. We have been offering those remotely through telehealth and Zoom meetings and things like that.
Yes, thank goodness for technology that we have today.
Yes, no kidding.
So as people are practicing social distancing, but still looking for ways to help in the community, And I know that you've shared a few of those through social media already, but what else can we do to help you during this time?
Sure. Well, that's a great question. You know, we at first put out that plea for masks, and we are good with masks right now, but you never know when that might change. We want to make sure we have those available at all times. So that might be something we need in the future. You know, honestly, food and snack items and things like that, that continues to be a great need for us. Our donations, we have stopped taking donations on a regular basis, so we're definitely seeing that impact our food supply. And so that would be, that's something that, and if people do want to donate, they can just call ahead and we can arrange for that. Something that's really exciting I wanted to share is that we are creating what we're calling a wall of hope in our shelter during this time, that and we're going to put up positive notes and messages from board members or other employees or just the community in general. And so if people have some a note of encouragement, either for staff or for those that are staying with us, or a cool picture that their kids drew or something like that, we would love to add that to our wall of hope. And so those are things that people can do if they want to give back at this time.
That's awesome. I can't wait till you guys have a full wall to share with all of us.
Yeah. We're pretty excited.
Good. So I have one final question. And what is something that you want people to know about Children's Inn as we continue to go forward, and hopefully have a time of less social distancing as well?
Well, you know, obviously this has been a crazy, challenging time for everybody. And I just, when you look at those that are utilizing our services, they are even more at risk. They're more vulnerable. They, you know, their future is even more unknown than yours and I's. And I think that that's something that, you know, that we think about here. And as hard as it is to come to work and do this work and you know, all those risks that we're taking, you know, we know that we need to do that for those individuals that are even more at risk. So I just want to make sure that if there's anybody watching who needs our services, that they know that they're available, and that's something that we've never stopped and we won't stop offering, and that it's important that continues for people. The other thing I would just mention is that, you know, before this kind of overtook our community, Children's Inn was on an exciting path of building a new building and working towards that, because our capacity, and we have really outgrown where we're at right now. We were in those, you know, early stages of planning our new building. And so we are committed to continuing to do that. It's probably going to look a little different as far as timeline and all of those things, but we know that the need is still there. And so that's something that we're still very excited about and looking forward to the future is our new building and what that can do for our community and the victims that need our services.
For sure. Well, thank you so much for your time today and getting to know a little bit more about what you guys do and sharing that with the community. We know that it is some days very stressful for what you have to do, and it definitely is appreciated. We appreciate you. United Way for sure. So thank you so much, and I hope you have a great day and enjoy this beautiful weather.
Yes, thank you so much, Annie.